Hi, I'm Dr. Lee. I'm a vascular surgeon from Vegas Vascular Specialists, and I'll be speaking about Thoracic Outlet Syndrome today. Thoracic Outlet Syndrome is a unique condition in which, typically our vascular patients have severely blocked, occluded vessels that cause a variety of symptoms, but Thoracic Outlet Syndrome is typically a condition in which there's extrinsic compression of the nerves and vessels that run in between your clavicle and your first rib. Causes can vary. You can have congenital stenosis of that thoracic outlet space in between your clavicle and your first rib. You can have an extra rib impinging on that space. There can be trauma. There can be repetitive overhead arm movements where there's muscle hypertrophy in that space that can also cause impingement of these vessels and nerves. Some of the symptoms that you would typically experience, one, it could be pain. You can have numbness and tingling in your arms. You can also have weakness as well. There are variety types of thoracic outlet syndrome depending on the vessel or the nerves that are impinged. Treatment can vary from anywhere from just medication versus physical therapy versus surgical decompression of that space to alleviate the extrinsic compression on the nerves and vessels. Post-operatively, these procedures are very well tolerated typically, and post-operatively patients do very well. They stay in the hospital anyway from 1 to 2 days and go home after a few days. We typically see very good results and outcomes from these surgical decompression procedures that we provide here at Vegas Vascular. There are multiple approaches to thoracic outlet syndrome, surgical approaches, including above the clavicle, below the clavicle, as well as transaxillary, where patients who would prefer more cosmetic results can get as well. So we do provide these services here at Vegas Vascular, a complete and thorough approach to the treatment plan for thoracic outlet syndrome.